Dr. Ebonie Vincent, and I am a practicing physician in Orange County, California. I do a lot of foot and ankle surgery, and I'm excited to introduce to you a product called Accufix. Accufix is a wonderful alternative for a joint fusion of the big toe. It's actually replacing damaged cartilage to restore and give you more function. Please reach out to myocpodiatrist.com and reach out to me to see if Accufix is good for you.
How do you decide between joint resurfacing or joint fusion?
So a lot of people come wanting to fit more into regular shoes, go hiking, play basketball, play tennis. Those are all things that you can do with a joint replacement. Joint fusions, you can do some of those activities, however, you will be limited. Certain shoes you won't be able to wear, certain activities such as yoga poses and things of that nature you probably won't be able to do as much. But with Accufix, those things are possible.
What to expect after surgery?
So after you receive the AccuJoint, the patients can expect there to be the normal swelling and a little bit of pain with any other surgery. But shortly afterwards, about 3 to 5 weeks after you remove those sutures, you're getting a lot more range of motion, you're a lot less painful with your joint, and it's only a matter of time before you get back to your normal activities. Please reach out to myocpodiatrist.com and reach out to see if Accufix is good for you. It's a great way to restore and maintain motion for your big toe joint.